Hi, my name is Keith Shaddix. I'm a manager with the Georgia State Fire Marshal's Office. The Georgia Long-Term Care Emergency Preparedness Educational Program has been a great benefit to the residents and facilities in the state of Georgia. This program benefited long-term care facilities that gave them more detailed information about emergency preparedness, real-life examples, and opportunity to ask questions. It also allowed them to realize that they're not alone. There's many partners out there that can help them accomplish this goal. This program helped our fire marshals to understand the emergency preparedness program better. Each line item as far as the requirement, why is it required, how is it implemented, and how we can best help the facility meet the requirement. The program has been a tremendous success. We've got so much positive feedback from the facilities, the residents, the administrators, getting more detailed information about the program, understanding it, real-life examples, helping us assist them with the program. We've gotten a lot of great feedback.
Hi, I'm Pam Clayton with the Georgia Healthcare Association. I am the Vice President of Quality Advancement and Regulatory Affairs. The Georgia Healthcare Association provides support to skilled nursing care centers, assisted living providers, and home and community-based services across the state of Georgia. The Georgia Long-Term Care Emergency Preparedness Educational Program that has been made available to providers across the state of Georgia has been extremely beneficial. Certainly they are doing all that they can do each and every day at the center level to meet the needs of those that they serve, and the availability, the development and availability of a standardized and consistent curriculum to help them understand how to develop a comprehensive emergency preparedness program has been invaluable. It has allowed them to direct resources and time and focus at the center level and feel confident that employees and associates that they send to the training will receive accurate and consistent training and education that will benefit employees, residents, leadership as they return to the center level and share what they have learned. So we've been very grateful for the availability of this program across the state. Emergency preparedness efforts and effectiveness does not occur in a silo. And so I think to truly be effective and functional, the partnerships are truly foundational and vital to the success and efficacy of efforts. And so again, I really feel like this educational effort has helped to strengthen those partnerships, help folks to better understand what the team members and partners do across the continuum, which will benefit well into the future.
Hi, I'm Billie Jean Hollingsworth, Safety Officer at Brown Health and Rehabilitation. The Georgia Long-Term Care Emergency Preparedness Educational Program has benefited our facility in many ways. I think one of the strengths for us is they don't give us a limit of who can attend. So I each time was able to take all of my safety committee members so that they could hear what I was hearing so that we could bring that information back to the facility. The courses that we attended, the basic and the advanced courses, were very beneficial to our facility to get us prepared and keep us prepared for any kind of event. After attending the emergency preparedness courses, we had a tornado watch here. So we were able to utilize some of the things that we had learned. Our staff knew what our policy was and what they had learned from their education. We had a couple of sister facilities reach out to us saying that they were under a warning in another location. So we sent the word out that we needed to update bed counts so that if we had to provide bed availability, it would be out there for them.
Hi, my name is Pamela Masters. I'm a Healthcare Coalition Facilitator for the state of Georgia at District 4 Public Health. As a Healthcare Coalition Facilitator, my role is to help any kind of healthcare provider with their emergency plans, their trainings, their exercises, anything that they might need for information as far as being prepared for a disaster or a public health emergency. I think that the Georgia Long-Term Care Emergency Preparedness Educational Program has significantly benefited the long-term care facilities and agencies here in Georgia. The program has benefited the healthcare coalitions, first off, financially. It's not something we had to pay for, but the expertise was certainly there. It also brought long-term care into what I call the family. We want healthcare to come to the coalitions, be a part of the family, benefit from the expertise that we can offer, whether it's routine daily emergency preparedness and plans and trainings and exercises, or whether you need support because something has happened. I think the additional benefit of the program is it's been offered in every coalition's region, and that has really allowed consistency across the state with the training, so that no matter who came to the training, they were all getting the same message. And in this day and age where there is so much turnover in healthcare, that means if someone works at one particular facility, when they go to another facility, they have the same information and they're going to just plug themselves right into that facility's emergency preparedness program because they've all learned from the same source. And to us, that's very critical.